Officials of the National Health Insurance Secretariat have released more information on the five-phased plan being rolled out to ensure Bahamians have access to affordable health care. N.H.I registration continues at the National Health Insurance Board offices across the country, and officials say to get your care, you must get your card.
N.H.I Ferguson covered a press conference this morning, updating the public on many of the concerns expressed by stakeholders.
There's been some hesitation from the medical community over national health insurance. Some doctors and senior consultants from the private sector have expressed that while they agree with N.H.I, they do not support the program as presently outlined. Deputy Chief Medical Officer Dr. DeLon Brennan explains that while there was some initial apprehension, more doctors are buying into the plan.
It wasn't that they don't want to sign on to the program. They're engaged and they want to be a part of it. What they want is more information from us, but they also want to feel as though their concerns and their needs are being addressed as a part of designing the N.H.I program. And again, through our consultations with them, even as late as this weekend, they have been able to voice some of those concerns. We have shown how we can modify the original models to address those. So I think we're actually getting to a point where they feel more comfortable with what we're going to start out with.
More information on N.H.I is being released through the website nhibahamas.gov.bs. It was launched on Monday. Permanent Secretary for the N.H.I Secretariat, Peter DeVoe Isaac, says the plan was in the work for quite some time with one goal in mind.
The government of the Bahamas is committed to improving our healthcare system to position our nation as the healthiest country in the Caribbean region by the year 2040.
So far, N.H.I officials have only publicly estimated the cost of Phase 3.
The primary care phase of N.H.I Bahamas will cost the government approximately $25 million from April until June and will be tracked and forecasted each quarter thereafter based on utilization rates and cost saving.
That figure derived from household surveys, an estimation on what is spent on healthcare by Bahamians and what is already being spent for the National Prescription Drug Plan. N.H.I officials have also encouraged those with private health insurance not to drop their coverage.
If you're able to access those same services and not have to pay for them, it is likely that you will seek to have a decrease in what your insurance premiums, whether that's as an individual or as a group, might be, because you no longer require those services of private health insurance. But that's something that we'd like people to be able to experience first before they make any of those changes, because we want them to feel comfortable that they're actually getting service provision, and it isn't just that we're saying you're going to get it and giving empty promises. We're saying see, touch, and feel the system first, and then decide whether you want to make a change to your private health insurance.
Legislation on N.H.I will be released within the coming days. N.H.I officials plan to hold town meetings throughout the country to update various sectors and the wider community on the plan, which will be rolled out in 5 phases. N.H.I Ferguson, ZNS Network News.